Hello all of you. A very good evening. Yes, am I audible and clear? Alright. So yes, I can see the chat box. Yes, hello and a very good evening all of you. I hope all of you are healthy, fine and in full spirits and ready for today's session, that is best practice MCQs in pediatrics. Okay, so actually this is like a YouTube session which I'm taking just to introduce you that from 1st of February on as special sessions, that is the free sessions, I'm planning to take some interesting MCQ sessions in pediatrics that will ensure that you not only will get a good practice, good hold in pediatrics, plus you will be able to self-analyze yourself that at what level the preparation is required, how much of preparation is required, and of course I'll be helping you in studying and preparing your pediatric subject. Okay, sounds good all of you? Yes, hello. Now I can see all the chats. So Abhishek, welcome. Gaurav, Mansa, Arshad, Dashrath, hello. Anshuman. So very good evening all of you. Good to see all of you here. Some of you I already know, some of you are new. So welcome all of you. I am Dr. Priyashree Mukherjee, your pediatrician and pediatric hemato-oncologist and your educator in Unacademy app. So before I go ahead with the MCQ sessions, I want all of you to press the notification button, right? Give a thumbs up to my lecture because that really encourages me. Somehow I'm obsessed. I keep on checking my previous lectures. कितने thumbs ups मिले, कितने thumbs downs मिले. तो उससे थोड़ा सा मुझे I get encouragement. I like it. It might sound very childish or something like that, but I really do like it. And at the same time I want to introduce you to the iconic subscription as well. Okay, so this is you know that the Unacademy and the Prep Ladder has come together. So all the benefits of Unacademy, that is the live classes, the quizzes, right, the batch courses, the structured schedules, along with the Prep Ladders video lectures, the question banks, the rapid revision courses, the handwritten notes, all these things you will get together in iconic subscription. And on the right side you can see here it is the subscription fees. So actually it is so less, it is even less than the college fees. So 12 months it's just 49.5k. 18 months the amount is bit more, but if you see the per month investment, it's hardly anything. And this minimal costing, you're actually getting 19 subjects ready-made coaching. आपको कहीं travel करने की ज़रूरत नहीं है. You don't have to actually put any efforts. You just have to sit and listen and be attentive and keep on solving the live quizzes and the mock tests, right? And after about yes, Jyotsna, actually short cases for final year, yes, I'll surely do that, Jyotsna, for you, right? Okay, and most importantly, if you like my sessions, please don't forget to use my code. My code is Dr. Priyashree-YT, Dr. Priyashree-YT, and if you don't remember Dr. Priyashree-YT, you can just write Dr. Priya 10. इतना तो याद रहेगा. So whenever you are subscribing, just use Dr. Priya 10 as your as a code, right? And you will avail 10% discount. And if you have already taken the Prep Ladder subscription, so we are still open for the plus subscriptions. The subscription pattern is similar. One more thing I want to tell you all, very important information, is that we are launching 4 most important batch courses. So good news for the FMG and those the NEET and the next aspirants. So for FMG we are having focus batch for FMG 2021. for this NEET PG, we are having the last mile to crack NEET PG 2021. So before 18th April, there will be a complete quick revision of this. Then we have this Target Next 2022, right? We have 2 batches for that, Target Next 2022. And on the top of that, most importantly, don't forget this. Don't forget this, okay? So aap likh lo so that you won't forget. Alright, and the last information which I want to share about Unacademy is that we are still having the daily free test series. Okay, so the timings are as follows. For NEET PG T20, we are starting it at 8 p.m. These are like 20 questions, 20 minutes. Okay, then at 8:30, we have this FMG Daily T2021. Okay, at 8:30 p.m. 9 o'clock we have got 2 sessions. You can quickly finish one and jump to the other. NEET PG 2022 test series, and the other one is INI-CIT Daily T2021. So these are all 20-minute sessions, 20 questions. You can use your time and quickly solve these questions. Whichever questions you find difficult, we are always there to help you out with them. Okay. Alright, and if you want to unlock these free plan, please use Dr. Priya 10. Dr. Priya 10. Priya yaad rahega sabko. Dr. Priya 10. That's it. Alright, so some questions over here. Okay, Sumi, this session is till 7:30. This is a half-an-hour session. Okay. And yes, and Jyotsna has said, please do spotters in PDF for final year. So surely I'll just see if I can make out one special session for all of you where I can discuss the short cases and the spotters. Yes, I can do that. Why not? Okay. Chalo. So let's begin with the MCQs. All of you ready? So get set and go. So the first question. A 2-year-old male child presents with a lump in the right side of the abdomen. Ultrasound revealed it to be a solid mass. On examination, his right arm and leg were found to be longer. The most likely diagnosis is nephroblastoma, neuroblastoma, angiomyolipoma, infantile polycystic kidney disease. Okay. Rheumatology, yes. Rheumatology, I'll take a session for rheumatology. Okay. So now I got 2 topics. One is the spotters for pediatrics and the other one is rheumatology. Very well. Yes, so now this is a question. Very nice. Yes, Med Easy Deepika has given the correct answer. No, Deepika, I'm afraid. Okay, so I'm getting a mixed answer between A and B. Alright, so 25 students are there right now. I want 25 answers. Only 4 of them answering is not fair enough. All other 20 candidates, please answer it. It doesn't matter that even if it is wrong, we are all in a learning stage. So don't worry, I'm here to teach you. Tell me about this condition. It's a 2-year-old male child. Look at the age. Look at the age. So definitely this is a pediatric age group. There is a lump in the right side of the abdomen. So it's an intra-abdominal tumor. Secondly, his right arm and leg were found to be longer. So there is a component of hemi-hypertrophy. Yes. So my diagnosis is an intra-abdominal tumor with hemi-hypertrophy. Beckwith-Wiedemann syndrome. Isn't it? Beckwith-Wiedemann syndrome, which is associated with nephroblastoma. So those who have given, yes, absolutely correct, Siddharth. So very good. So there was an isolated confusion between A and B. Luckily nobody marked D, so that makes it quite clear that you have a clue to this, that this was an intra-abdominal tumor. Okay, now talking about neuroblastoma. Had it been a neuroblastoma, please remember all of you very carefully, as the clinical based questions like these are actually simpler than the one-liner questions. Why I'm telling you? Because these clinical based questions will get 3 or 4 hints for all of you. Generally one-liners, they don't have the hint. Either you know the answer or you don't know the answer totally. But the clinical based question will give you 2 or 3 hints, and then you can think, analyze, and you can derive the correct answer. So that is the benefit of these clinical based questions. Okay. Now, if this was a case of neuroblastoma, they have to mention some or the other symptomatology related to the sympathetic nervous system. So they have to mention something like flushing, sweating, or hypertension. They have to mention something about the raccoon eyes, or skin manifestations, or ophthalmomyoclonus, or any symptoms related to the encasement of the aorta, or even the inferior vena cava. Okay, so just remember this. Absolutely correct, med. Okay, so the answer is nephroblastoma, that is Wim's tumor. Alright, what are the other syndromes associated with Wim's tumor? One is WAGR syndrome, isn't it? What is WAGR syndrome? It is Wim's tumor, aniridia, and growth retardation. Okay, so that has got a very good question. How to differentiate it by mass? Ideally and clinically, so that it is quite difficult to differentiate it. The only thing is the Wim's tumor will not cross the central line. The Wim's tumor will not cross the central line. It will go down. That is the only way that you can differentiate Wim's tumor from neuroblastoma. But otherwise, mass-wise, it is very difficult to differentiate. Okay, it is the coexisting symptoms that you can use to differentiate. Alright, now let's jump to the next question. Examine the image carefully. The least developmental age of this infant is 5 months, 9 months, 12 months, 15 months. First of you all, you tell me what is the child doing. If you understand what the child is doing, then you will be able to pick up the answer. What is the child doing? Yes, anybody? The least developmental age of this infant is? Yes, what is the answer? 5 months, 9 months, 12 months, 15 months. Come on, quickly give me the answer. Very good, Monica. Fantastic. What about others? Wonderful. Yes, Medici, Smart, Smiley, Siddharth. Fantastic. The child is creeping and crawling. Okay, creeping and crawling by putting his abdomen above the ground. Can you see? The abdomen is well above the ground. This milestone is classically achieved by 9 months of age. Very well answered. Very well answered. Okay, so by 8 months of age, the child is able to sit without support. By 9 months of age, they start creeping and crawling. By 10 months of age, they learn to stand with support. By 11 months of age, they learn to walk with support. And by 12 months of age, they can walk and walk independently, stand and walk independently. In addition to that, they can start doing the casting also, that is voluntary throwing of the balls. That is, by 1 year of age they can play simple ball games. ठीक है, revise हो गया. We have done this developmental milestones in one of our YouTube sessions, right? Okay, so this is what a child between 9 to 11 months can do. So creeping is infant lifts his tummies off the floor just like in the image and moves around on the hands and knees. So this is classically between 9 to 11 months. And what is bear walking? Infants walking on hands and feet without using tummy and knees. Okay, just like soft teddy bears. Okay, and they will just be holding some support which appears classically between 11 to 12 months. So if bear walking, they are asking you, bear walking is simple walking with support. Don't get confused with the term. Okay. All right. Next question. And this is a very good question actually. Immediately after the delivery, the infant starts crying and is moving all the 4 extremities actively. Heart rate is 140 per minute. He is making a grimace on the attempt to put the suction catheter into his nostrils. His body is pink but extremities are cyanotic. Which of the following is the next best step in the management of the infant? Intubate the child, dry the infant and keep warm, apply silver nitrate solution to the eyes and place the umbilical catheter. Yes. Very good. Yes. Priya, Swati, Monica, Anuja. Fantastic. What about others? Med? Very good. Yes. So this is a absolutely nice, vigorous child. And I would not intervene in any how. This is not a child who will require any neonatal resuscitation. So simple, I'll just follow the initial steps. That is, I will dry the infant, keep the baby warm and shift the baby to the mother. Alright, because more or less if you see the Apgar score is 8 out of 10. Isn't it? With the grimace. Right, with the grimace and acrocyanosis giving it 1 point score each. Rest other factors are score 2. So that gives it a Apgar score of 8. And 8 means a vigorous child, a normal Apgar score. So I will not do any intubation. I will not require any catheterization or put anything in the eyes. It is absolutely normal child. Siddharth, how did you get the calculation of 7? Grimace is score 1 and acrocyanosis is score 1. Okay. Yes, score more than 7 is considered to be normal. That is correct. If that is the question, what you are asking? Score more than 7 is normal. This child in this scenario score is 8. Right? All of you agree with me? Absolutely correct, Swati. All of you, all others agree with me? All 37 people? Yes? So I will just dry the infant and keep the baby warm. Okay. Next question. Fetal growth is maximally affected by insulin, growth hormone, cortisol, thyroxine. Yes? A very easy question, very commonly asked question and a very good question. Fetal growth is maximally affected by insulin, growth hormone, cortisol, thyroxine. Very good. Yes, I was expecting all of you to give me the correct answer. Insulin and insulin-like growth factor is the most important component that will help in the fetal growth. Now, I just have a little bit of literature for all of you. Okay, just concentrate at this portion. Concentrate at this portion. Okay, the insulin-like growth factor system and IGF-1 and IGF-2 in particular plays a critical role in fetal and placental growth throughout gestation. Disruption of insulin-like growth factor 1, IGF-2 and the receptor gene retards the fetal growth, whereas disruption of IGF-2 receptor or overexpression of IGF-2 enhances the fetal growth. Okay. IGF-1 stimulates fetal growth when nutrients are available, thereby ensuring that the fetal growth is appropriate for the nutrient supply. The production of IGF-1 is particularly sensitive to undernutrition. IGF-2 plays a key role in placental growth and nutrient transfer. Very simple. ठीक है? Right? So no confusion. So the whole game is around insulin. It's not thyroxine beta. One of you gave the answer thyroxine. It is by default insulin. Now you know the entire game of insulin, how it is related to the fetal growth. Right? Very good. Okay, this is little bit tough question but a very good quality question. And listen to this question very carefully. A term baby is going to deliver via cesarean section to a mother with multiple medical problems. Problem number 1, she's got seizures for which she takes phenytoin. Problem number 2, she has got rheumatic heart disease and she is taking penicillin daily. Problem number 3, she's got hypertension for which she takes propranolol. Problem number 4, she's got DVT in her right calf, for which she was started on heparin therapy. Which of the following medication is likely to cause harm in this newborn at delivery? Penicillin, phenytoin, propranolol, heparin. This is a very smart question. Actually इसमें ज़्यादा सोचने वाला कुछ नहीं है, थोड़ा सा लॉजिक लगाया तो you will be able to answer. Remember this medication, they are saying which medication can be given in this. If given in this term pregnancy, it's a term pregnancy, she's just going to deliver via C-section, right? So term pregnancy में ऐसा कौन सा medicine है जो देने पर से complications हो सकता है? Okay, so I'm getting a mixed answer between B and C. Now if you remember, phenytoin has got a teratogenic effect. That means phenytoin, if given in the first trimester pregnancy, then it will have a teratogenic effect, isn't it? My question is term pregnancy. During this term gestational age, the mother has developed all these complications. So at this stage, phenytoin देने से भी कुछ नहीं होने वाला, because whatever development was to happen has already happened. So it's not going to hamper the baby as such. What will actually hamper the baby? It is propranolol. Very good. Those who have given C as answer is correct. Propranolol will directly impact the heart of the baby. How I will tell you? See here. Propranolol causes growth retardation. That is one issue. When given throughout pregnancy, diminishes the ability of an asphyxiated infant to increase the heart rate and cardiac output. So propranolol is dangerous, and plus in addition to that, so there are high chances that the resuscitation efforts might fail in cases if you are giving propranolol, and it has been associated with hypoglycemia and apnea. So these are the two things that you must remember. Baki ka teratogenic effect is there, but propranolol when given in the term gestational period can have these two deleterious effects. Okay, so quite simple. Next question. Which of the following is true statement regarding vaccination in children with nephrotic syndrome? Killed vaccines are contraindicated. Live vaccine are given 4 weeks of completion of steroid therapy. Live vaccines are administered during treatment with 1.5 gram per kg per day of alternate day steroids, and all of the above. This question might be little bit sound new, but I have already discussed this in one of my lectures in immunization. Those who have attended my immunization lecture, they will be able to give this answer. So basically they are asking you about the principles of vaccination. Nephrotic syndrome तो एक scenario है आपको दिया हुआ. It is just a scenario that has been given to you. They are basically asking you about the principles of vaccination. Very good. Yes, absolutely fantastic, Amrita. Med Easy 1 to 5 Sumi, Anuja, Smart Smiley, Krish. Yes, Priya and Rajneesh. Jai, I am afraid you gave the wrong answer. Rajneesh, you gave D. No. So देखो A and D both are wrong. Why? Killed vaccine are contraindicated. There is no good reason to contraindicate killed vaccine in a child with nephrotic syndrome. In fact, killed vaccine can be given to even a immunocompromised child. So a child of nephrotic syndrome receiving steroids, there is no contraindication of giving killed vaccine. If it has to be given, you can definitely give. Point number C, because one of you has marked D, so I'll just clarify C point. See, live vaccines cannot be given to immunocompromised child, especially when a child is on steroid, because steroid makes a child immunocompromised, right? So no point of giving live vaccine when the child is on alternate day or daily dose of prednisolone. Rather than that, B is the only point which is correct over here, that once the steroid therapy has been stopped, after that, exactly after 4 weeks, you can start giving the live vaccines. Got it, all of you? So very interesting question based on the principles of immunization. So very good. We have seen this. Okay. Next, what is the size of IV cannula shown below? Now this is a purple colored cannula which is oftenly used in a premature child. ये इतना फाइन और इतना छोटा सा कैन्यूला होता है that sometimes just while using it ये टेढ़ा हो जाता है. So it's a very fine cannula and can be used only in the preemies जो 28 kgs 28 weeks के 25 weeks के जो एकदम preemies जो होते हैं उन्हीं में यूज होता है ये. Absolutely correct. So smaller the size of the cannula, larger is the gauge number of those cannulas. So the smallest cannula is number 26. So very good. I can see some of you giving D as the answer. So here is the image for all the cannulas. Okay. So biggest of them being 14. Out of that, in medicine, what I think we use this white, green and pink and blue, isn't it? In pediatrics, we use only 26, 24 and 22. We don't go beyond 22. That too 22 we are using in bigger children, in adolescent, in big babies. Otherwise, for neonates, infants, we prefer to use the new cans. And once the child is like almost 2 years old, we can safely use the blue cannulas. Okay, got this all of you? This is a very beautiful image. I really love this image. Okay, next question. Which genetic disorder is associated with this? What is the image showing? Trisomy 13, trisomy 18, trisomy 21, trisomy 5. What is this image showing? The genetic disorder is associated with what? Trisomy 13, 18, 21 and 5. So what is this image? Showing. Okay, Sumi, I'll just share the picture again of the cannula sizes. Don't worry. First, let us finish this question. What is this image showing? This image is showing. No ray. Holoprosencephaly. Ventriculomegaly में आपका cerebellum वगैरह गायब थोड़ी हो जाएगा. This part of the brain is totally गायब. So it's a holo. It is a holoprosencephaly. And in which of these trisomies do you see holoprosencephaly? Trisomy? Yes, absolutely correct. Wonderful, Amrita. The answer is trisomy 13. Very good. Lovely. ठीक है? So yes, Swati, Jitendra, correct. Sujit, Nida, all of you have given the correct answer. Holoporencephaly is a classical finding for Patau syndrome, that is trisomy 13. Right? Apart from that, what else can you see in trisomy 13? Cutis aplasia, microphthalmia, right? Then what else? Polydactyly, then cleft lip, cleft palate, right? Come on, keep talking. What are the different things that you can find in Patau syndrome? Keep telling. Cutis aplasia, microphthalmia, polydactyly, cleft lip, cleft palate, then renal anomalies, like starting there is a huge range of renal anomalies that can be ectopic kidneys, there can be a horseshoe shaped kidney, or even renal aplasia, and the cardiac starting from VSD and ASD. Okay, so these are some of the important points which are present in Patau syndrome. Okay, and holoporencephaly. Okay, neonatal seizures due to which etiology carries a better prognosis? Meningitis, hypoglycemia, congenital malformations, subarachnoid hemorrhage. Which one has got a better prognosis? Okay, very good. I can see some of you giving the correct answer. Absolutely correct. Wonderful. The answer is subarachnoid hemorrhage. See, there are two conditions in neonatal seizures that has a better prognosis. One of them is subarachnoid hemorrhage. The second condition is hypocalcemia. Hypocalcemia. The worst prognosis. These are the good prognosis. Now talking about worst prognosis, lies with the idiopathic type of neonatal seizures in conditions where you don't know the cause, the exact cause. Even hypoglycemias don't have a very good prognosis. Recurrent hypoglycemias, they don't carry a very good prognosis. So the answer to this question is subarachnoid hemorrhage. Very well answered. Okay. Alright. Last question of today. The pattern of inheritance shown in this pedigree is given in which genetic condition? Neurofibromatosis, beta thalassemia, Duchenne muscular dystrophy, Huntington's disease. So I have taught you the mnemonics for Mendelian pattern, isn't it? So here I am seeing that the mother is a carrier, isn't it? The father is normal. So the next generation, son has developed the disease and the daughter is a carrier. And again when the daughter gets married, her daughter becomes a carrier and the son becomes DMD. चलो मेरे मुंह से आंसर निकल गया. So this is a classical case of Duchenne muscular dystrophy. Duchenne muscular dystrophy is a X-linked recessive condition. ठीक है? So the answer would be Duchenne muscular dystrophy. See, thalassemia is autosomal recessive disorder. So thalassemia is definitely not the presentation over here, and neither it is looking like a dominant presentation. Okay, so Huntington's is out of question. So my answer is Duchenne muscular dystrophy. Okay, so that is all for today. I hope all of you enjoyed these 10 sessions of pediatrics MCQs. So these are the variety of questions. ऐसे ही question exams में आते हैं. So all of you have answered really very well, and now I'm quite confident that most of you are well prepared. You just need a little bit of brushing, and then you will be as sharp, just absolutely ready for your entrance exams. Okay, so I will be coming next month with more such interesting sessions. So all of you, good night, take care. Okay, just 1 minute. I think Sumi wanted to see those Neocans, right? Nose IV cannulas. See this properly now. Sumi, I'm flashing this slide for you. Okay? Yes, these cannulas. I'm flashing this. Are you able to see, Sumi? So mostly in adults, we use the white, green, pink and blue. Okay, I've seen these being used in adult wards, whereas in pediatrics we are only using these one. So these are mostly for pediatric usage, and lesser the size of the cannula, more is the gauge number. ठीक है, तो ये आपको याद रखना है. आ गया ध्यान में? चलो, I end my session over here. Good night all of you. Study well. Any difficulties, don't forget to send me a message so that whatever is your difficulty, I can clear them. Secondly, please don't forget to use my code for, even if you are planning to attend the questions, the quizzes, or for the batch courses, use Dr. Priya 10. Very simple code. So subscription के लिए code use करो, you will avail 10% discount. It's a good deal. Enjoy and have a great time. Okay, चलो bye.